Ulcerative colitis is a chronic disease that affects the large intestine, also called the colon. In this condition, the inner lining of the colon becomes inflamed and develops small sores called ulcers. These ulcers can bleed and produce pus. The inflammation in ulcerative colitis usually starts in the rectum, which is the last part of the colon near the anus. It can then spread upward to affect more of the colon. At its core, ulcerative colitis is an autoimmune disorder. This means that the body's immune system, which is supposed to protect us from harmful invaders like bacteria and viruses, mistakenly attacks the lining of the colon. This attack leads to inflammation and ulcers, or open sores, in the colon's inner lining. One of the key features of ulcerative colitis is that it only affects the innermost lining of the colon. This is different from Crohn's disease, which is another inflammatory bowel disease that can affect all layers of the bowel wall and can occur anywhere in the digestive tract, not just the colon. The continuous nature of ulcerative colitis inflammation is also another distinguishing feature. The affected areas are continuous, without patches of healthy tissue in between. In the United States, it's estimated that about 1 million people have ulcerative colitis. The condition can occur at any age, but it's most often diagnosed in people between the ages of 15 and 30. Types of ulcerative colitis. Ulcerative colitis is often classified based on how much of the colon is affected. The main types are: number 1, ulcerative proctitis. This is the mildest form of ulcerative colitis. In this type, inflammation is limited to the rectum, which is the area closest to the anus. People with ulcerative proctitis often have the best prognosis. Number 2, practisigmoiditis. In this form, inflammation involves the rectum and the sigmoid colon, or the lower end of the colon. Number 3, left-sided colitis. This type affects the rectum, sigmoid colon, and the descending colon, which is the part of the colon on the left side of the abdomen. Number 4, pancolitis. This is the most severe form of ulcerative colitis, where the entire colon is inflamed. It's important to note here that the extent of colon involvement can change over time. Someone might start with ulcerative proctitis and later develop more extensive disease. Causes of ulcerative colitis. The truth is, we don't know exactly what causes it. However, researchers believe it's a combination of factors, including genetics, the environment, and an overreactive immune system. Genetics play a significant role. If you have a close relative with ulcerative colitis, your risk of developing the condition is higher. Scientists have identified over 200 genes that might be associated with inflammatory bowel diseases like ulcerative colitis. However, having these genes doesn't guarantee you'll develop the condition. It just increases your risk. Some studies suggest that a diet high in fat and processed foods might also increase the risk. Others point to stress as a potential trigger. The use of non-steroidal anti-inflammatory drugs like ibuprofen has also been associated with an increased risk or worsening of the condition. The gut microbiome, which are the trillions of bacteria that live in our intestines, might also play a role. People with ulcerative colitis often have an imbalance in their gut bacteria, with fewer beneficial bacteria and more potentially harmful ones. However, it's not clear whether this imbalance is a cause or a result of the inflammation. The immune system's role is crucial in ulcerative colitis. For reasons we don't fully understand, the immune system mistakenly identifies food, beneficial bacteria, or other substances in the colon as foreign invaders. It then attacks the lining of the colon, causing inflammation and ulcers. Symptoms of ulcerative colitis. The hallmark symptom of ulcerative colitis is bloody diarrhea. People with the condition often experience frequent, urgent bowel movements, sometimes waking up at night to use the bathroom. The stool might be loose and mixed with blood, mucus, or pus. Abdominal pain is another common symptom. This pain is often described as crampy and might be relieved by having a bowel movement. Some people also experience a constant feeling of needing to have a bowel movement, even when their bowels are empty. Fatigue is a significant issue for many people with ulcerative colitis. This isn't just feeling a little tired. It can be an overwhelming exhaustion that interferes with daily life. The fatigue can be due to the body's inflammatory response or from the anemia caused by blood loss. Weight loss is common, especially during flare-ups. This can be due to loss of appetite, fear of eating because it might trigger symptoms, or the body not absorbing nutrients properly due to inflammation. Other symptoms can include fever, especially during severe flare-ups, and anemia due to blood loss. Some people also experience symptoms outside the digestive system, such as joint pain, eye inflammation, or skin problems. It's important to understand that ulcerative colitis is a chronic condition characterized by periods of active disease, called flare-ups, and periods of remission. During a flare-up, symptoms can be severe and disruptive to daily life. During remission, a person might have few or no symptoms. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of ulcerative colitis. It often starts with a detailed medical history and physical examination. Your doctor will ask about your symptoms, how long you've had them, and if you have any family history of inflammatory bowel disease. Blood tests are usually done to check for anemia, or low red blood cell count, and signs of inflammation in the body. Stool samples might be collected to rule out infections that can cause similar symptoms. The gold standard for diagnosing ulcerative colitis is a colonoscopy. In this procedure, a long, flexible tube with a camera on the end is inserted through the anus to examine the inside of the colon. The doctor can see any areas of inflammation or ulceration and take small tissue samples, or biopsies, for further examination under a microscope. Other imaging tests might be used as well. These can include CT scans or MRI scans to assess the extent of inflammation and check for complications. A newer technique called capsule endoscopy, where you swallow a small camera that takes pictures as it passes through your digestive system, might also be used in some cases. Treatment for ulcerative colitis. The goals of treatment are to reduce inflammation, relieve symptoms, prevent complications, and ideally, achieve and maintain remission. Medications are the cornerstone of ulcerative colitis treatment. The type of medication used depends on the severity of the disease and the individual patient. Here are some of the main types. Number 1. Aminosalicylates. These drugs, which include sulfasalazine and mesalamine, work to decrease inflammation in the lining of the colon. They're often used for mild to moderate ulcerative colitis. Number 2. Corticosteroids. These powerful anti-inflammatory drugs, like prednisone, are used to quickly bring inflammation under control during flare-ups. However, due to potential side effects, they're not used for long-term treatment. Number 3. Immunomodulators. These drugs, such as azathioprine and mercaptopurine, work by suppressing the immune system to reduce inflammation. They're often used when aminosalicylates aren't effective enough. Number 4. Biologics. These are the newest class of drugs for ulcerative colitis. They target specific proteins involved in the inflammatory process. Examples include infliximab, adalimumab, and vedolizumab. These drugs can be very effective, but are typically reserved for moderate to severe cases or when other treatments haven't worked. Number 5. JAK inhibitors. These are a newer class of oral medications that work by blocking certain pathways in the inflammatory process. In addition to medications, lifestyle changes can play a crucial role in managing ulcerative colitis. While there's no specific diet that works for everyone with ulcerative colitis, many people find that certain foods can trigger or worsen their symptoms. Common triggers include dairy products, high-fiber foods, spicy foods, and alcohol. Keeping a food diary can help identify personal triggers. Stress management is also important, as stress can exacerbate symptoms for many people. Techniques like meditation, yoga, or regular exercise might be helpful. In some cases, surgery might be necessary. This is typically considered when medications aren't controlling the disease effectively, if there are severe complications, or if there's a high risk of colon cancer. The most common surgery for ulcerative colitis is a proctocolectomy, where the entire colon and rectum are removed. This can be curative for ulcerative colitis, but it's a major surgery that results in the need for an ileostomy, where the end of the small intestine is brought through an opening in the abdomen to expel waste, or an internal pouch to collect stool. At the end, living with ulcerative colitis can be challenging, but with proper treatment and management, many people are able to lead full, active lives. Now, we want to hear from you. Do you or someone you know have ulcerative colitis? What treatments did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.